Test. Alright, it's working. Hello, everyone. That was very strange. It wasn't me. It was OBS. I take no responsibility for this. Am I too loud now? I don't know if my mic's always full on full volume. Streaming is always... There's always stuff happening. There's always, like, technical difficulties, even though you've changed nothing. But I'm glad I got it to work. I just had to, like, reset my mic in OBS for some reason. It is Friday. It has been a day here. It has been a political day here. And I'm not happy. Let me say it like that. But what I am happy about is that I got to play Sanctuary today, which is a board game in the same line, I guess, as Ark Nova. People call it a sequel, I believe. I don't know. It definitely has some Ark Nova feelings, but it definitely plays different. You have tiles. Hi, Mom. You have tiles instead of cards. And I think it's a lot more streamlined, although I found the iconography not great, and the accompanying rulebook not amazing, if I'm honest. But I enjoyed playing it. It also has a pretty good solo mode, I saw, so I will probably solo that as well. But today we are here to save a patient. We are going to be playing Medical Mysteries. I played this before, either last week or the week before that. And so we will be playing patient number 3 today, which is also of medium difficulty. I will quickly explain how the game works, and then we'll get into it. There will be no spoilers during my explanation of the game. However, once we start playing it, there will obviously be spoilers for patient number 3. This is one of those games that you can't really play again, because once you know what's up, you know what's up. There's no, like, alternate path. I mean, I guess you could, but I don't think you should. So spoiler for that. Medical Mysteries is a co-op game, which means you play it with your fellow players. It says it plays up to 4, but you could basically play it with an infinite amount of players. The game comes with a tutorial patient, which will teach you how the game works without you having to read the rule book, or you read it in, like, little parts, which is kind of nice. And yeah, I played that one. I played the first one, played the second one, and today we're doing number 3. And it comes with a total of 4 patients. I don't know if I said that already. Basically, every patient has this little envelope where you have a little blurb, and it'll also tell you what is inside. So you always have to make sure that you have everything listed. Got my hair today. One of the things that's in there is the epilogue sheet, and you should be really careful not to accidentally read that, because it will spoil the whole case, so don't do that. You always start by reading the patient intake interview and the electronic medical records. The interview will usually instruct you to take a story card. Every patient comes with an entire deck that's numbered, and a status card. And both of those will have some actions you can take. Every patient also gives you a little patient form that you're going to use, and you're going to be writing down your actions there. It'll also instruct you, after like a certain amount of time has passed, you'll get a status update, which will change or might change how your patient is doing. So yeah, you get 3 actions per 2-hour period, and after those 3 you get a status update. All actions that you take come with a little code like GAS, which you then look up in this neat little booklet that you get with the game, and that will usually either give you like some information, or it'll tell you to take a specific story card, which will like further the story of that patient. So yeah, like I said, everything you write down on your patient form. You have some in-game hours to complete it, although I believe you can keep going if your patient hasn't left already, because last time we played on stream, our patient left because they were feeling all right, even though we hadn't like asked all the things yet. At some point, you will be instructed to make your final conclusions on the back of the card, or this patient form, sorry. And then you read the epilogue, and the game will give you a score based on how well you've done. I don't really care about the scoring necessarily. I just like the story and making sure that I got everything. I really enjoy this. So you have the New York one, which comes with 4 patients. There's also a Miami one, although I've seen that it is hard to get, especially in North America. It is available here in Dutch, but I had to really search to find the English one. I ordered it this week because I was like, I need more of this. And it'll be coming next week, but I had to order it from the UK Amazon. And as far as I could tell, that was like the only place that's available for me, but also for North Americans. So be warned, I guess. I'm not sure if they're making another one. I hope so, because I really, really enjoy this type of game. Let me see if I missed anything in my explanation. Final report, epilogue sheet. You get some actions. No, that's basically the explanation. So that concludes me explaining the game. So after this, it'll be spoiler galore for patient 3. Hey Eric, how are you? So let's get started. Today, oh wait, let me minimize. Oh my gosh, I'm warm. I just had soup. My entire body's warm. So today we are treating patient number 3, Gabriela Ferreira. The next patient is Gabriela, who comes to the emergency room with her worried mother. Gabriela only cares about filming herself with her phone. That is the blurb we get before we go into everything. Let me open stuff up on the screen. I have to give another thanks to my lovely husband who took pictures of every card again and uploaded them in OBS so that we could play this game. We can't see the card. I know, there's no card yet, Dries, but thank you. Okay, so we've got the patient intake. Is that this one? No, that's the electronic. Okay. Did I say cardigan? Oh, card again. Don't be mentioning cardigans to me. I'm a Swiftie. Okay. So we've got Gabriela Ferreira. She's 17, a female. The patient is accompanied by her mother because, oh yeah, welcome to this game where I'm going to be mispronouncing every medical situation. She's accompanied by her I'm just not gonna say that again, by her mother because she is a minor. I'm concerned for my daughter, says her mother. She just got back from Brazil 2 days ago. Gabriela interrupts. It's not a big deal. This could have waited until morning. We didn't have to come to the ER. Not a big deal, says her mother. Just suddenly falling to the ground is no big deal? I was tired, says Gabriela. I've got jet lag and I'm probably dehydrated. You assure them you will give Gabriela the best care possible. You ask Gabriela to tell you why she's here. Every summer for the last 4 years, Mom has sent me to stay with her brother back in Brazil. It's awful. It's this tiny little village. Town, interrupts her mum. Mum? Towns at least have cell reception, says Gabriela. I'm surprised they even have electricity and hot water. That's not true, says her mom. You know what she sends me, says Gabriela. She's afraid if I spend my summer in New York, I'll start doing drugs or get a boyfriend or something. Hello, Mom, they have drugs in Brazil too, except there's nothing to do there but swim. At least I got a good workout. She shows off her arm muscle. And we got a back where it continues. Like getting fit helped any. I couldn't even upload to my YouTube channel. I've probably lost hundreds of subscribers. You know how hard it is to get followers? And look at my face. You have to do something about my face. I can hide the rash on my legs with pants, but not my face. Oh, but not even makeup can cover these. She points to the many blotches on the right side of her face. I can't go on YouTube looking like this. Gabriela reaches up and holds her head. Just a headache. I'm exhausted. I haven't slept well since I got back. She says something else, but you can't hear her. You ask her to repeat it. It burns when I pee, she says, embarrassed. Okie dokie. So, it tells us to take story card 1 and take status card 1, itchy and irritable. I feel that. I will show you that in a second, but before I do, I'm gonna show you the electronic medical record that this game gave us. Oh, I'm locking some of it. Alright, so some stuff we already know. Her height and her weight is there. She's a student. Eric says, I love how it starts as fainting was the only thing, and then she names like 7 other things that aren't good. Yeah, I know. I mean, that's how it goes, right? I mean, I feel like I've also done that at a doctor. Of like, oh yeah, I have this, but also like this isn't this. It's just, I don't know. So complaints: headache, fatigue, weakness, burning when urinating, urgent and frequent, rash of red small raised bumps on face and legs, recent illness, yes. Recent travel, yes. Returned 2 days ago from Brazil, where she spent the last 2 months. She has some medications that we can look up. And there's no known allergies. All her vitals are normal. Past medical history, generalized anxiety disorder. I feel like all of these have an anxiety disorder. Treated with some stuff. Oh, so one of the medicines is for that. Well controlled per last pediatrician visit note 3 months ago. Pediatrician? I know she's 17. I know she's not a legal adult, but pediatrician I associate with like children. Like children. Family history. Mother and father are alive and well. No siblings. Social history. Lives with mother. Never smoked or vaped tobacco. No alcohol or illicit drug use. Then the back. Nope. Move that. Nope, don't move that. You know what, I'm gonna... Why is it moving the wrong thing? Losing my mind. Okay. General. Visible fatigue, no weight loss, fever or chills, appears well and in no acute distress, alert and oriented to person, place, and time. Psychiatric, some recent changes in mood, cooperative, appropriate mood and behavior. Respiratory, normal, no shortness of breath or cough, no change in vision or hearing, no sore throat, neck stiffness or tenderness. Neurologic, headache and dizziness, no focal neurological deficits. There's a problem with nerves, spinal cord, or brain function. Oh, no, none of that. Okay. Cranial nerves, grossly intact, normal, but not individually tested. I don't know what that means. So I'll put a pin in that in my brain. Cardiovascular, no palpitations or chest pain, regular rate and rhythm, no murmur. Musculoskeletal, generalized weakness, no muscle or joint pain. Abdomen, normal, soft, non-tender, no palpable masses. And extremities, no edema, so no swelling, non-tender. Skin, yep, that's a word. Pruritic, itchy, just say itchy, you know? Rash on face and legs. So an itchy rash on her face and legs. Multiple erythematous pupillus. Yep. Red small raised bumps on face. And same with that, vesicles. Red small fluid-filled bumps with linear streaking on legs bilaterally. Gastrointestinal. No abdominal pain, nausea, vomiting, or diarrhea. Dysuria, burning on urination, urgent and frequent. Gynecology, history, last menstrual period 14 days, no history of pregnancy. And then her height and her weight. So she lost a tiny bit of weight, but not barely anything. And her blood rate and stuff is basically the same as the last test. Okay, want to look at those meds that she's taking, just to see. So I didn't say this during the explanation, but the game comes with some booklets that give extra information on what certain things are. It could also like nudge you in a certain direction. Drugs. Oh, my screen is fucked. See, that's what you get. That's what you get. Okay, weird. Okay. So I'll show you again. I'm gonna look up the medications that she's taking. Escitalopram, a selective serotonin reuptake inhibitor. Oh, that's an SSRI. I never knew what that stands for. Used to treat depression and anxiety. Possible side effects: nausea, insomnia, constipation, headache, fatigue, dizziness, increased sweating, bloody stools, fainting, irregular heartbeat, seizures, eye pain, and vision changes. So some of her symptoms could be explained by that. However, her exam also says that it's well controlled per the last doctor's visit 3 months ago. And I feel like if her medication caused this, that would have been before. So I feel like that's unrelated, but definitely keep that in mind. And then she has ethanylestradiol, used to treat moderate acne in women who are at least 15 years old and have started having menstrual periods. Again, possible side effects: nausea, vomiting, breast tenderness, headache, breakthrough bleeding, high blood pressure, blood clot, stroke, heart attack, and liver problems. Can be used together with something else as a contraception to prevent pregnancy. Okay. And the other thing that it could be taken with is the norethindrone, which she's using. Which she's taking, using sounds. Used in conjunction with the ethanyl as a contraceptive. Okay, so that's her contraceptive. And that could also have some side effects. But I don't know. Keep that in mind, I guess. Okie dokie. So that's the starting information we have. And now we've got a status card. Oh, I need a writing utensil. We need a status card and a story card. So we've got a story card over here and a status card here. Let me try to... I'm gonna make this a little bit smaller. So we've got a status card. So on the status card, you will see certain actions we can take. So we can interview the patient with some questions that are on story card number 1 to the left. And there are some tests we can do, which are in blue. There's a more invasive test. Or no, that's a... is that usually treatment? Usually the treatments are in yellow, but a biopsy is, I'm pretty sure that's also a test. There are some drugs we can give, which are darker, like greenish. And then below there are some experts we can ask their opinion on. Every one of those actions on that card would be like one action on the sheet. And again, we get 3 actions before we get an update. But the story card, if we interview her, we can ask her 2 questions per action. So let me look at the questions we can ask her. We can ask, what can you tell me about your rashes? When you went swimming, what was the water like? What are your headaches like? Did you injure your head? Do you drink alcohol or take any recreational drugs? And tell me about your YouTube channel. It's so funny. I feel like with female patients, the one thing they always do is a pregnancy test. Anyway, let me first write down her name because it's important that she's humanized. Gabriela Ferreira. Mom says 1. Yeah, right? What can you tell me about your rashes? That's a good one. Definitely gonna ask that, and it might not be a bad idea to ask about the water, right? She's like, rashes? Eric says, I like 2. All right, well, 1 and 2 it is. So I'm gonna interview patient. So I'm writing down interview patient as the first action. And we're doing question 1 and 2. So question 1, it instructs us to look at QAS. So I'm looking it up in this little booklet. QAS says, take story card 2. So I'm going to grab story card 2. I'm also going to show y'all story card number 2. Oh, wait, let me post that in live, by the way. Oh, boy. Oops. Nope, didn't mean to do that. The way that these layers work is... can I change the size of this? So that's what her legs look like. Mom says, looks like your rash you've had when you go into the sun. When I went into the sun? Oh, yeah, the heat rash. Yeah. It does. The little red spots. Gabriela says, the rashes started up a few days before I came home. Ugh, who wants to look like this? You've got to clear up my face. That's your job, right? What? I don't know how I got them. I just know tons of mosquitoes were messing up my photos. Uh-oh, mosquitoes. Gabriela scratches at the rash on her legs. You warn her not to scratch it. But it itches so much. I feel you, girl. That sucks. Okay, so we've got card number 2. And then for the other one, I removed it. But when you went swimming, what was the water like? That instructs us to look at WRS. Oh, wait, I'm going to write down QAS. I'm also going to write down mosquitoes, because that feels like a thing, right? And then WRS. WRS says, take story card 3. Okay. Gabriela says, the water was amazing. It was clear and a perfect temperature. I went swimming every day. There was also this huge rock to jump off of. It was like 6 meters up. Hey, I just posted this for my trip. Gabriela's mother says, no one wants to see your video. Gabriela ignores her. Take story card 30. Okay. Is this going to come with a YouTube link? Because I'm going to laugh. Number 30. Amazing. The video shows Gabriela striking a pose in her bikini. Today I'm going to jump off this cliff. Gabriela steps back into the trees and then takes a running jump off the ledge. Screaming, she plunges into the water below. She rises, spitting water and yelling, I'm totally badass. Eric says, she's been in Brazil long enough she measures in meters. I wonder if there's some sort of localization. I wonder if, like, although this is the English version, but that is really funny. New Yorkers don't know what meters are. Do they use meters in Brazil? Alright, well, not much about the water. But we know something about mosquitoes. Do we ask her more questions? I don't really know. Maybe we should ask, or some tests, yeah. I'm thinking about that, but like, what would we suddenly test? You know, like a... Okay, Eric says they used a metric system. Okay. Hell yeah, Brazil. A blood test, yeah. There's a couple of blood tests, though. Test. We have the urine test for the petahertz. Oh, that's a good one, Eric. That is something that we should treat urgently. She probably has a UTI. We could, yeah, we should do a urinalysis. Okay, so let's do that. Stat. Urinalysis. Maybe we can give her some drugs. A skin biopsy. Is that... Oh yeah, that's one of the treatments on her leg. Interesting, you can call the neurologist, but I don't see a mental test yet. Well, the neurologist, she's dizzy and she's having headaches and stuff, so I guess that's why. But let's do this UAA. Take story card 11. Okay. Lovely, that's P. The urologist examines the urinalysis results. These results are abnormal. They strongly suggest your patient has a urinary tract infection. Yep, UTI. So it's giving us some values. A lot of P. Maybe it's a really small cup, to be fair. Alright, we've got some results that I don't know if we can do anything with. Like, I don't know if they expect us to do anything with these results besides she has a UTI. Let me see what they say about UTIs. UTI. Inflammation in the urinary tract due to bacterial infection. Symptoms include dysuria, so the burning sensation while urinating, increased urinary frequency, urinary urgency, fever, chills, or abdominal discomfort. Diagnose with urinalysis and treat with antibiotics. If left untreated, may lead to kidney infection. So we should probably give her some antibiotics. But which ones? We have some lotion. So we can treat her with some stuff. Oh, let me pull up that one. So we can treat her with like a lotion, which I guess is for her skin. So the calamine lotion is over-the-counter lotion that can ease itching from bites and rashes. That's probably one that we're going to have to give her soon. It's not warning us that it could do something. She's currently itchy and irritable, and she was scratching, so maybe actually we should do that first. But anyway, then we've got one of the antibiotics used to treat many kinds of bacterial infections. Avoid use if the patient has a penicillin allergy. Yeah, we had to avoid that one with the last patient. Spoiler. Ciprofloxacin can cause adverse side effects, including diarrhea, vomiting, and nausea. So it's the other one's preferred. Oh yeah, that's what we Ew, excuse me. Ooh, I just fully burped into the mic. I'm so sorry. That just came up. Then we have dexamethasone, oral corticosteroid medication used to relieve symptoms of inflammatory conditions such as swelling, redness, itching, asthma, and skin rashes. May also be administered before antibiotics in case of bacterial meningitis to reduce the potential for brain damage. Uh-oh. Then we've got fluids slash acetaminophen, often recommended as a first-line treatment for mild to moderate pain. Taking more than the recommended dose or combining with alcohol increases the risk of kidney damage and liver failure. And nitrofurantoin. That's an antibiotic. First choice treatment for simple urinary tract infection. Will not work on the common cold, flu, or other viral infections. Okay. That is... Alright, so we're probably going to have to give her that, but I think we should give her the lotion first to ease her itchiness, which is probably distracting her a lot. Do y'all agree? I'm asking, but I'm still doing it. So calamine lotion. Which gives us cal. Let us see. Okay, cool. Sorry. You applied a lotion to the patient's rashes to relieve itching. Well, we sure did. We had 3 actions. Let me write down that she has a UTI, by the way, for a previous one. Okay. We're going to get an update, and our status card says for the 2 a.m. update that we should look at EFX. We're probably going to get bonus points for the lotion. Come on. EFX, take story card 9. Okie dokie. Let me pull that up for y'all. The last stop on your rounds is Gabriela. As you enter the room, she's arguing with her... Last stop? It is EFX, right? Yeah, story card 9. Okay. The last stop on your rounds is Gabriela. As you enter the room, she is arguing with her mother. I don't understand why you can't just trust me, yells Gabriela. I trust you, says her mother. It's all those New York boys I don't trust. They don't always listen when a woman says no. Gabriela lifts her hands and shouts in frustration. Then you watch as her eyes roll back and she collapses to the floor. Okay, take story card 24. That's not good. Yeah, ruh-roh. Oh my fucking god, sorry. Emergency! Gabriela begins to convulse and thrash uncontrollably. She's having a seizure. Nurse Judy clears the area so Gabriela doesn't hurt herself. After putting a pillow under Gabriela's head, Nurse Judy starts a timer. Start a stopwatch. No, I'm not gonna... No, what? Or write down the current time. Keep it running. I'm streaming. I'm gonna need a little more time than that. Keep it running until you find a story card that tells you to stop. Take status card SC2. I am gonna pull up a timer, but I will do it after I read everything out loud. Okay, if the stopwatch reaches 3 minutes or 10 minutes, we're gonna have to take different story cards. Okay, we are on a timer. I don't like doing that, if I'm completely honest, especially on stream, so we'll see how I deal with it, but I will grab story status card number 2, which I put somewhere. I lost the status card. Oh my god. Where did I put these? Oh. Well, what did we do? This hasn't happened before. I'm flailing. All right. So status seizure. Stop moving around, stupid fucking thing. All right. Hey Siri. Hey Siri. Siri hates me. This is nothing new. Fine, I'll do it myself. No, not an alarm. No, not a timer. Stopwatch. There we go. Okay, so what can we do? Intubation, neurologist. Is she seizing because she has a UTI? Should we ask a neurologist? Do we have time? Do we intubate? What's a lumbar puncture? See, now I have to look up a lumbar puncture. I'm looking up seizure in the booklet. I don't know. There's no seizure in the booklet. What do we do? What does a lumbar puncture do? I don't think we should just do that. Lumbar tested to test meningitis, leukemia, and other illness. Needle, blah 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 blah. No, don't think we should be doing that while she's seizing. Should we? I feel like we should intubate a neurologist. I'm stressed. What do we do against a seizure? A neurologist. You don't fold it around for nothing. Yeah. I mean, we can. I think he's just going to say, okay, well, he's going to tell us what to do. Okay, we're going to ask a neurologist, KDJ. I need to write this down. KDJ. KDJ, take story card 16. If she's conscious, intubation won't help. Yeah, I don't think intubating would. I don't know. It will help her breathe, maybe. You called a neurologist on your. Oh, sorry, let me show you the card before I start reading. I'm just so stressed. You called a neurologist on your cell phone and explained Gabriela's seizure symptoms. Neurologist says give her 4 milligrams of lorazepam, but only if she's still in seizure. Administer it via IV at least 5 minutes after the seizure started to avoid over sedation. If the seizure stops by itself, do not give the lorazepam. Just wait a total of 10 minutes until she's stabilized. Feel free to call back after you've stabilized her. This completes your current action. Take another action as part of this emergency. Yeah, okay. I mean, we're still before the whatever minutes we had. So okay, let's do that. Let's give her lorazepam. She is, because that's her status. Because we're below 3 minutes. So I am gonna give her lorazepam or RST. Yeah, good memory. I completely missed that. RST. We are hitting 3 minutes. We've just hit 3 minutes, but this is part of the thing. RST. Take story card 7. Stopwatch. Check the stopwatch or current time to see how much time has passed since she started her seizure. The thing is, when we started doing this, we were below 3 minutes. So I'm going to take... Oh, sorry. Let me show you the card again. I'm going so fast, I mean. we are now on the second one between 3 and 5. But again, when we pulled the card, we were still below 3. So I'm going to take that one. He did say something about... Oh, wait. Give her 4 minutes, but only if she still... Administer it via IV at least 5 minutes after seizure started. Oh, wait. Actually, it's better. Actually, it's better if we do it now. Because it says at least 5 minutes after the seizure started. So we should have waited. But the thing also said we have to take card 18 if it reaches 3 minutes. So I guess we do that first. Because we're waiting until 5 minutes. Okay, 18... because I totally saw what that meant. Okay, so 18. As suddenly as it started, she stops... Oh, shit. Fuck. Okay, we're cheating now. She stops thrashing, but she's still out of it. Nurse Judy looks at her timer. Her seizure lasted 3 minutes. She puts her timer back in her pocket. I'm going to leave the timer running in case she has a second seizure. Keep your timer running. So, do we pretend that I didn't pull that card because I didn't look at the thing correctly? Or do we not pretend that? I'm okay with cheating because I should have been paying attention to that. And we didn't pull anything else. So, I'm gonna cheat. We didn't look at it. We looked and it said to look at the timer. And then I was like, wait, he said something. Okay, so it is still running. What do we do? She had a seizure for 3 minutes. If it stops by itself, do not give it. Just wait a total of 10 minutes until she's stabilized. And then he said, feel free to call back after you've stabilized her. Yeah, okay, so... no lorazepam. Now what? I mean, she still has a UTI. I don't feel like that's... I don't feel like the UTI is like that... you know? Oh my gosh, I don't know. Yeah, exactly. Okay, time is ticking. What do? We have so many... we have very little to do and a lot of drugs to give. We have some new ones, right? We've got levetiracetam, anti-epileptic used to prevent further seizures, used even when something like lorazepam is successful. As the other thing will only last for a few hours, leaving the patient at risk for delayed seizures occurrence. Take 1 pill every 12 hours. I think we should prevent more seizures, right? That sounds like a good thing to do. I'm just gonna... do that. Lev. Take story card 29 and then 4. Okay, 29. I'm going as fast as I can. And then 4. Nope, not 28. Oh, fuck. Alright, 29. You give her blah, blah, blah to prevent her from having additional seizures for the next 12 hours. And then 4 says stop the timer. Okay. Emergency resolved. She has recovered from her seizure. She is conscious and can communicate without trouble, although the experience has clearly left her shaken. Finding the cause of her seizure may be the key to her long-term survival. Take status card 3. recovery and also stop the timer. Could mosquitoes make you seizure? Maybe. I feel like definitely there's something there. Why are you asking me? I'm not a doctor. Okay, seizure card or a status card, seizure card. Her head injury might be a problem for that. A problem for what? What head injury? Let me hide all these cards. All right, her status right now is recovery. That was a question. We could ask her about, we still can, it's still an option in the interview patient. We didn't ask her that, but we could ask if she hit her head. As far as we know, on the electronic medical record, it doesn't say anything about that. Just that she has a headache and some fatigue and weakness. Okay, we have one more action we can do before we get another update. We could ask a neurologist again, since he said you can call me back if she's stable. We can also do a brain scan. There's an MRI, a CT. There's a lot we can do. We still have to give her something against her UTI, but again, I feel like that is not the most, like, it could lead to a kidney infection, but I don't think antibiotics work that fast. So even if we gave it to her now, I think it takes a while. Eric, did I read the 10-minute card? No, I didn't have to read the 10-minute card because we didn't hit 10 minutes. Or a dermatologist. Yeah, I think that a dermatologist is a really good one. To look at her skin. You know what? Let's ask the dermatologist. Derm. And that is WQQ. There's a good chance that the dermatologist is going to say do a biopsy, but I'm not a dermatologist, so I don't know. I'm not going to cut into this woman for no reason. WQQ, take story card 17. The timer situation was really stressful. Okay. Ooh, yep. Examining the rash on Gabriela's leg, the dermatologist says, this kind of rash is often cereal dermatitis or swimmer's itch. Given that your patient was traveling in Brazil, it could be contact dermatitis from touching a Brazilian pepper tree, an allergen related to poison ivy. Oop, that's fine. That was a coaster that fell. Or viral dermatitis such as chikungunya fever, spread by an infected mosquito. I recommend performing a skin biopsy to determine which it is. Yeah. Pouring some more tea. Hey, you gotta ask the expert, right? Okay, so we're gonna do a skin biopsy because I think that's really important. But first, we're gonna get an update. It is 4 a.m. So we get VOP as an update. Take story card 36. You'll see it before I do because I put it on the screen and then I start reading. Gabriela is a far cry from the exuberant, defiant young woman who first came into your hospital. Now she is withdrawn and from her red eyes appears to have been crying. She's 17, of course. Look at how sad she looks, poor girl. When her mother apologizes for her lack of response to you, Gabriela doesn't even complain. Instead, she looks at the floor and picks at her leg rash absent-mindedly. You know what? We may have wasted some time giving her the skin treatment, like the salve, but I stand by it. The lotion. Look at this sad girl. Just have to burp again. Okay. So yeah, let's do a skin biopsy. I don't know what a tissue biopsy. I don't know what the difference. It doesn't make a. It doesn't make a difference between tissue biopsy and skin biopsy leg. Probably the leg, right? What did he say? A skin biopsy is what he said. Yeah, okay. So we're gonna do that. Skin biopsy SKB. Yeah, I guess it is. SKB. Take story card 12. Ew, gross. The dermatologist says, I performed a skin biopsy on her leg rash. I did not see signs of parasite larvae or parasite eggs in the skin. Ugh. So this rules out swimmer's itch. She doesn't... That swimmer's itch? She doesn't have a fever, so it isn't viral. It must be a contact dermatitis, likely from a Brazilian pepper tree. Treat it with an oral steroid. Okay, but can that cause her symptoms? Okay, I'm gonna keep this apart because this is an important one. Oral steroids. Okay. Get this card out of here. Disgusting. Okay. These are tests. Where did I leave this booklet? Right here. Let me look at fungal infection. No. Maybe there was a tree at the rock she jumped from. Yeah, I mean, that's very possible. Dexamethasone. Oral corticosteroid medication used to relieve symptoms. Oh yeah, we looked at that one before. So that's what he said, right? Oral steroid. Corticosteroid? Is that... What's the other one? Flu. Antifungal. No. No, we gave that to her. Lorazepam, no. Nitro. Nitrofurantoin. Yeah, we have to give her the nitro thing for her UTI before she leaves. Prazi. Oh, no. Definitely not that. And fluids. Alright, let's give her the dexameth... Meth? We're giving her meth? Methasone. I have a whole new appreciation for actors that just have to say all these things. Okay, so that is XED. Take story card 21. Gabriela swallows the dexamethasone down with water. When you check back on her, she reports that she isn't suffering from itching as much. Okay. No longer itchy. Not so itchy. Alright, we have to find out why she was seizing up. Let me see if I can find anything in these books about contact dermatitis. Brain health, procedures, tests, blood. Can a pepper tree cause that? I don't know. That's what I'm trying to find out. I think we should ask the neurologist back, to be honest. She still has a painful peeing. Yeah, she does. But again, I feel like the UTI... I feel like a UTI wouldn't cause this. So I am going to ask neurologist back. HSB. Huh? D, not B, D. It's like, that doesn't exist. Take story card 19. He says, the seizure was under 5 minutes. That's good. You want to give her levotirizumab so that she doesn't have another seizure. I already did that. There are many possible causes to consider. You might want to rule out serious causes like meningitis or encephalitis. Or there might be a more simple explanation, such as your patient overdosed on antidepressants or using drugs. Do we ask the 17-year-old if she was taking drugs? Anyway, before we do that, though, we get another update. It is now 6 a.m. and we are getting the update DVL. Psh, there's no drugs in Brazil, Eric says. No. Well, she did say there's also drugs in Brazil, Mom. How do you know? Gabriela, how do you know? Take story card 33. Gabriela seems to be doing much better, given that she's in the middle of making a video of herself when you walk in. You notice that Gabriela is careful to only show the left side of her face. Look, she says as she notices you. This is my doctor. You wave to the camera as Gabriela's mother tells her to turn off her phone. Grumbling, she complies. You check on her vitals, and Gabriela seems to be stable. You should really find the cause of the seizure. I know, game. God damn. Okay. Okie dokie. The cause of the seizure. Should we ask her about the drugs? I mean, we should, right? Like, we should. That's what a doctor would do. Or a CT scan. Yeah, but there's so many scans. We could ask her. So that's a good question, actually. The difference between an MRI and a CT. I sort of know, but let me read it from this, which will explain it a lot better. So a CT scan is a series of X-ray pictures providing more detail than a conventional X-ray. Usually the first choice for imaging to identify disease or injury, particularly complex bone fractures and severely eroded joints. A CT scan can detect tumors or lesions within the abdomen, various types of heart disease and head trauma, injuries, tumors, blood clots. However, some soft tissue conditions, such as ulcers, may not always be apparent. Whereas an MRI is magnetic resonance imaging, non-invasive scanner using magnets to produce a 3D detailed images from inside the body. MRI scanners are particularly well suited to capture images of non-bony parts or soft tissue of the body, including nerves, ligaments, and tendons. Eric says, do we trust she will tell the truth about doing drugs, and should the drug test just be done without asking if she did them first? Good question. So if we ask her about drugs, we can also ask her if she hit her head. Although, you know what? Don't talk to patients. Just do tests. Let's do a drug panel. So we're going to do a drug panel. And a card says, there's like a flippy card symbol, which means you flip it over. And the back will show all sorts of codes for the different kinds of tests with a little code, like in a column, depending on what time it is. One says, but she's in hospital long enough and maybe she's not so cocky anymore and tells the truth. That's a nice thought, but it would still be the same. We don't have a new card. So it would be the same answer she would give when she first came in. The game is not that interactive. Drug panel, and it is now 6. So it's actually one of the later ones. Maybe we can't catch it anymore because it's now been too long. that'd be gnarly. Because they do give you different results at drug panels. Oh my gosh. Drug panel YSD. CRSD. Okay. Is RSD one of them? Yeah. Oh, that's the same one. RSD. Oh, so they just give you the same codes just to make you think something's different. That's cute, actually. RSD. The test result comes back normal. Strange, you were expecting to see a positive marijuana test. Given a relationship she has with her mother, it's likely Gabriela stopped using... Is that for me? Oh, I just got a drink. Given a relationship she has with her mother, it's likely Gabriela stopped using a week or so before she came home from Brazil in case her mother decided to have her tested. That's fucked up. It's also, why are you expecting a positive marijuana test? That's kind of strange, right? Okay, so no drugs. Right? So many assumptions. I'm like, okay. Okay, no drugs. So, to reiterate, the neurologist, which is the image looks male, but I'm just gonna say she. Meningitis or encephalitis, or an overdose of antidepressants. I don't see a reason why it would be an overdose. So I'm gonna rule that out personally. Meningitis or encephalitis. You know what? I'm gonna look those up to see if the booklets give us any indication. So meningitis is inflammation of the brain and spinal cord membranes. Symptoms include a fever, a headache, rash, and seizures. A lumbar puncture detects the cause of meningitis and guides treatment. Okay, see, excuse me. We could do a lumbar puncture to see if But if it's not meningitis, we might be doing that for nothing. So there's different types of meningitis. There's bacterial, cryptococcal, which is fungal, but I'm picturing cryptids. Parasitic, viral. That's a really painful thing to undergo. A lumbar puncture? I don't know if I know for sure what that is. I've seen it on a TV show, but... Oh, inserted into the space of the lower back. Oh, yeah. Yeah. Needle between your spine, yeah. So what you're saying is we should not just do that. So he said meningitis or... where's the card? Oh, in front of me. Encephalitis. Inflammation of the brain. Okay, so one is an inflammation of the brain, the other thing is an inflammation of the brain and spinal cord. So there's something going on with the brain. So we can do a CT or MRI. Let me go back again to the difference between CT and MRI for this specifically. So soft tissue basically or not. So CT is more about like bone disease or injury, particularly complex. She didn't have a fever, Mom says. No, you're right. I'm leaning MRI. Anyone else? Or not? It says CT, a series of X-ray pictures providing more detail than a conventional X-ray. Usually the first choice for imaging to identify disease or injury, particularly complex bone fractures and severely eroded joints. A CT scan can detect tumors or lesions, again, within the abdomen, various types of heart disease and head trauma, injuries, tumors, and blood clots. However, some soft tissue conditions, such as ulcers, may not always be apparent. And an MRI is a non-invasive scanner using magnets to produce a 3D detailed image from inside the body. MRI scanners are particularly well suited to capture images of non-bony parts or soft tissues of the body, including nerves, ligaments, and tendons. I feel like if we want to know about... What is a that sounds brainy. A highly invasive test where a surgeon removes a sample of a patient's brain to help diagnose brain illness, including swelling, tumors, blood clots, or other conditions. The test is a full surgical operation that can be performed awake or under general anesthesia. The surgeon removes a bone flap from the skull to directly access the brain and extract a tissue sample. It will then be analyzed with tissue biopsy. So we could just immediately send her into surgery. We don't have a lot of time left, though. We are on like the last 2 actions we can take. And we still haven't solved her UTI. Yeah, intense brain surgery, and we don't even know. Let's try... Wait, so you want to do CT? The seizure is caused by something, for sure. I was leaning MRI, but okay, I'll go with CT then. CT brain scan. Flip the card. CT brain scan. PAB. The scan is normal. Okie dokie. Another 1K. Yeah, that's gonna be a heck of a bill. Def more worried about seizure over UTI. Yeah. I mean, I want to give her the medication. You say that, but she could have serious kidney issues if a UTI is left untreated. It's just not, urgent. EEG is also brain. That's true. You are correct. Where's my... There's so much stuff in front of me. You don't even want to know. EEG. I think so, yeah. It's your heart, right? Yeah. Electrical activity in the brain. It helps with the diagnosis of brain-related issues. I don't know. I feel like meningitis doesn't necessarily show up on like a CT or MRI. Maybe MRI again. This teen is going to die. No, she's not going to die. We're going to help her, Eric. Oh, man. This is the last action we can do before we get another update. Mom says, luckily her mother has all the YouTube videos to remember her by. We're gonna save her, team. We're gonna save her. Okay, EEG, brainwave patterns. Can we get a real doctor in here? I don't know. I'm just gonna do an MRI. I'm gonna be stubborn. MNB. That's the last thing I can write down. Oh, I'm warm. MNB. Take story card 20. The MRI results are clearly abnormal. I told you. You see nodules in the temporal lobe with signs of swelling around them. This could be a simple case of inflamed blood vessels, an infection, or much less likely a tumor. You need to secure a tissue sample to diagnose Gabriela's condition. Eric says, love hearing my doctor be like, I don't know. I know. That's what I do as soon as I walk out of the room. I go, I don't know. All right. Need tissue sample. But first we're going to get an update because it is 8 a.m. Now I can't write anything down anymore. Boo. Okay. Aren't like MRIs weird? Like, look at this freak. Like, look how freaky we look from like top down. Like, look at our eyes. What is this? What kind of weird... All right. Update JPW. Humans are freaks. JPW. Takes story card 37. Uh-oh, y'all. Uh-oh. No! Okay. As your shift comes to an end, you check in on Gabriela. It's been an exhausting night for everyone. Gabriela can barely keep her eyes open. Can I go home yet? She asks. Gabriela, says her mother. Thank the doctor. I know, Mom, she says. I was going to. Thank you. Gabriela's mother gives you a wary smile. I didn't realize how much was going on with my daughter, she says. Thank you for everything. Your shift is over. If you want, you may take overtime actions. See instructions. Otherwise, it's time to complete your final report, then read the epilogue. See instructions. I don't know what those are, actually. Overtime. I know. We can't just be like, bye, good luck, see you soon when you sees again. Overtime actions. So this is the entire rule book. It's not very long. It's a little pamphlet. You have 8 hours. I should have read this. You have 8 hours to help the patient survive the night. However, some cases may be particularly challenging. If you reach 8 a.m. and need more time, you can keep going, taking as many actions as you need. However, you'll receive -5 points for each overtime action you take. For tests run after 8 a.m., run the later result code. Oh no, we're gonna get -5 points. I care so much about this. Mom says, we don't know shit. We know some shit. Eric says, the game over and over. You really need to solve the seizure. I know. They're like, you need to do this. And we're like, you could just leave. No, we're not gonna get minus points, but we're gonna not get points for not solving this. So like, we are solving this, team. I don't know where to write shit though. Okay. We're taking a tissue biopsy. Which is, oh wait, let me show y'all the thing again. BBY. Eric says, we did not solve the seizure, but we also didn't treat the UTI, so she's not as itchy though. Yeah, we gave her some lotion. Look, we're trying. This is a teaching hospital. Oh man, my throat. Look, taking tests, it all takes so much time, you know? We also gave her a CT scan she didn't need. I'm not taking the blame for that one. BBY. Take story card 35. Oh my gosh, gun. If you have tissue sample, take this. If you have tissue sample, take this. If you do not have tissue sample, you cannot perform a tissue biopsy. Choose another option. Oh. We have to do something else first. We're terrible doctors. Is this the lumbar puncture we have to do? There's a cat meowing outside. I'll be honest, that game Copycat effed me up. Oh god. I am very terribly sorry. We're gonna have to do the very invasive lumbar or craniotomy. I lost all my booklets again. There's too many. So do we want... Okay, so there's 2 tissues we can take. We can take a tissue of brain and we can take a tissue of something. A gun. You think the lumbar? Okay, so the craniotomy is her brain and the lumbar puncture... Oh, that's a test to detect meningitis. Well, we know... Well, we got the brain... Whoopsie. We did a brain thingy and that was abnormal, so I think we should take a brain... She has a fucked up brain. Yeah, we know from the MRI that her brain's not... That her brain is abnormal, so... Sorry, it's going to be highly invasive. You thought you could go home. You can't. That is code CRN. Exactly. Official doctor term. Fucked up brain. Certified. CRN. Take story card 25. Ma'am, I'm sorry to tell you. You have a fucked up brain. 25. Okay. Yeah. You want to cut into my brain? Says Gabriela. Cool. Can you record it for me? Gabriela's much less excited when you tell her that you're going to shave her head. Yeah, exactly. That was the first thing I thought of when I read this. I'm like, oh god, they're gonna have to shave her. Gabriela's mother takes you aside so Gabriela can't hear. Is this absolutely necessary? She asks, her voice tight. Then quieter. Is there anything else you can try first? If you decide to proceed, take story card 27. Otherwise, consider this action complete and choose your next action. Look at that face. That's the face that's staring at us right now. Do you need to do this? And we are going to say, yes, ma'am. Absolutely. We need to do this. Story card 27. Exactly. I don't know what else we could do. Except treat her UTI. Oh my gosh. We're gonna... Okay, sorry team, we're actually gonna have to perform brain surgery. Gabriela looks up at you from the operating table. I'm scared, she says, as the anesthesiologist puts the mask on her face. And then she's unconscious. The surgery requires you to peel the scalp back and cut a bone flap in Gabriela's skull. Then you'll remove a small piece of tissue to perform a biopsy on. Choose where you'll make the bone flap. What? Oh wait. We had a card. I'm gonna help y'all. Yes, we do have to look at the MRI. I was like, what? How would I know this? The game helps you. Okay. Nope. Oh my gosh. Sorry. OBS is kind of annoying with like layers. I feel like I clicked this thing. Okay. So definitely PZL, right? Seems to be pointing. Look at the ears on this drawing. Okay. PZL. Look up PZL. Take story card 34. And we also have to take 35, according to the other thing. We already have 35. Oh, because that's just part of the action. Okay. So 34. Ew. Okay. Trigger warning for what I'm about to show y'all. Oops, did I move the background? I did. Oh, why? Oh my gosh. No. Whoa, what the hell? Oh my god, I'm being rated by Ruel. This is the worst moment for this to happen. Hello everyone. I'm having trouble with my streaming background, and I also have a disgusting image on the screen. So I'm so sorry about that. How are you doing? How was the stream? What did he play? We are doing... Yeah, I'm so sorry about this. We are doing brain surgery. We are playing the game New York Emergency Room, which is a medical mystery kind of games, but like instead of solving a crime, which you do with a lot of these games, you're solving something. It's his birthday. Oh, congratulations. Yeah, I know. just a fun little board game stream. I will get this off the screen as fast as I can. You played Wordsy. I heard about that. Is that one of the online things, or is that an actual little game? I'm also fighting my background. I'm choosing to ignore it. Happy birthday, a birthday stream. That's so fun. What a great way to celebrate your birthday. All right, let me finish this real quick and get this off the screen because it's disgusting. You cut Gabriela's scalp and then peel it back to reveal the skull. Using a cranial drill, you saw away bone, revealing the brain, and carefully you remove a tissue sample from the target area that you can run a biopsy on. The operation is a success. You have a tissue sample. Okay, I'm gonna get rid of this immediately. Okay, so we have, I'll pull the other card that we have right now. We have a brain sample, so now we can take story card 14. Let me pull it up. Eric says, the image is really ramped up. We saw a pea sample, then a skin biopsy, then just a full brain. Yeah. It's not as bad as the pit, but there's definitely some images. I'm also turning the card over in front of my own face so I don't have to look at that anymore. Alright, the tissue biopsy results are disturbing. We found something unexpected, says the neurologist. At first we couldn't tell what it was, but with a bit of research and knowing that Gabriela has been in Brazil these past few summers, we discovered... also welcome to me mispronouncing every single medical thing. It's a thing. Schistosoma monsoni. That sounds like a delicious dish. I'll take 4 of those. Alright, take story card 26. Thank you for the follow, James Games NYC. This is your type NYC. Well, then you really have to play this. Well, not this one because you're getting spoilers, but we are treating people in New York. Let's get in there and fix that brain. Hell yeah, let's. Okay. I have to look that up now. It's a really fun game. So basically the game comes with 4 patients that all come in an envelope. And there's a difference in difficulty. There's also a tutorial patient, and then patient 1 is easy, 2 and 3 are medium, and then the last one, the 4th one, is harder. I'm gonna be playing that one probably next week. Jim's Games NYC says, I've been in the emergency room in New York, and it is a vibe. Oh, well. Maybe you're one of the patients in here. Let me grab story card 26. I'm also gonna look up whatever this disease is. Something is blocking it. It is this card. Schistosoma Mazzoni is my favorite Italian actor, Eric says. Yeah, exactly. 26. They make me pronounce this so much. Schistosoma are digenetic blood trematode flatworms. Yep. This species, Schistosoma mansoni, is found... Isn't that the new mayor in New York? I'm sorry. Is found in South America and the Caribbean. Infection occurs... I love Mamdani. No... no hate at all. Found in South America and the Caribbean. Infection occurs in fresh water where mobile larval forms emerge from intermediate host snails and penetrate the skin. More than 240 million people in 77 countries are affected by this parasitic disease. I love that it also teaches us things. Take story card 42. Okay, so we did see she did need the highly invasive surgery. You say ew snails, they mentioned mosquitoes, they mentioned a lot of disgusting things. Let me find this card. Just so y'all know, we chose to do invasive brain surgery, but before we did that, we got stared at by this face asking asking us if that was really necessary. Her mom was like, "Are you sure?" It says, "Nothing I love more than a parasite that gets into your skin." I know, just the idea alone. But it looks pretty. I wish I had one. Mom, you don't wish you had one. This is a 17-year-old girl who just came back from 2 months in Brazil. She has a rash, a UTI, and had a seizure and fainted. Yeah. She's scared in the tapeworm. I know. Imagine that in your face. Are you sure? Okay, take story card 42. Congratulations! Gabriela has survived the night. Now that you understand why Gabriela is having seizures, you can prescribe the proper treatment to stop them from occurring in the future. You can keep working with Gabriela until you're ready to complete your final report. We did it. We did it. But we still need to treat that UTI. Also, we need to treat her because I still don't know whatever that disease was. Schistosoma. So the game also comes with some booklets that have some explanations for everything from certain tests and drugs to also help you choose what you do. Because you get these status cards that have like a list of actions you can take, and that will give you some code to look up in a little booklet. Jim says, "After ramen, I'm glad I discovered your channel. I'll be checking out this game." That's so cool. Thank you. Goodbye. Thanks for checking in. Okay. I was looking up this little thing. Is it brain health? So it wasn't meningitis, which we thought it was going to be. Oh my gosh, I'm never going to find this conditions. Oh. I can't find it. A flatworm. How would we know how to treat it if it's not in one of these booklets? Procedures? No. Drugs? Or maybe we just need to look at the drugs again. Well, anyway, before we do that, we have to give meds. I think so, yeah. So we have to give her the nitrofurantoin. What does flu do? The flucto thingy. Well, you don't have to pronounce it. The flucto thingy is an metabolite, antifungal drug used to treat cryptococcal infections. Eric says, "I don't know if we have to do anything further because she did survive the night. I don't think this will change the result, or am I wrong?" No, it doesn't change the result, but when you score, it'll give you scores of like, oh, you get +5 if you gave her the correct medication, etc. Mom says the parasite is still inside her. Yeah. Because the card did say you can prescribe the proper treatment. And part of your final report that you fill out at the end is what is the cause, what treatments did you provide, and a recommendation. So I think we do have to give her more lotions. Okay, she needed the lotion. She was itchy, all right? It said urgent. She's itchy. I gave her some lotions. One lotion. Anyway, I'm going to give her the UTI thing first because she needs that. NPT. I swear this thing's just going to say, she's thankful. NPT. So I'm going to look up the code. You prescribe 50 milligram every 12 hours for 7 days to clear up the infection. You know what? She needed that, and I stand by it. And now we need to find out what to give her for this flatworm. Ooh. Okay. So the first thing, the amphocytorin. One day I will know how to pronounce this. This is a fungal infection again. It's not fungal, so bacterial infection. It's not an infection. It's a parasitic disease. You need to use PRA is to treat worms. Did you Google that? Did you Google this medicine? Eric says, I'm gonna get a PhD in medicine and become a doctor to be good at this game. Yeah. So I read that someone on BGG said that this game was not fun to play with actual doctors because they could just like solve this immediately. My mom says she Googled it. That's smart. I'm gonna read to you what this booklet says about pra. So praziquantel, got it in one, is an antiparasitic medication used to treat schistosomiasis and liver fluke. And then it tells you the dosage. Yeah, that sounds like what we should give her. Absolutely. P-R-A. I'm doing that. I'm opening the book. You give Gabriela a dose. There is no immediate effect, but you weren't expecting one. It's time to let the drug run its course. And I think that is everything that we can do for Gabriela. We gave her the medicine that she needs for her disgusting worm. We gave her some meds against her UTI. And more importantly, we gave her lotion against her itchy skin. And we treated her seizures. So, when you're done, you grab the epilogue. I'm going to pull that up for y'all as well. Again, special thanks to my lovely husband for taking all of these photos and putting them in OBS for me. Epilogue front. Oh, I don't know if you can read that. Let me see if I can just like. Before reading the epilogue, see FTG. Oh, that's new. That's the first time. And a pregnancy test. We did not give her a pregnancy test. She could be pregnant. We don't know. Is it now going to say FTG? Y'all are reading this and I haven't. If you did not administer or prescribe levetiracetam, I think we did. I know, just kidding. We did give her levetiracetam. That one prevents seizures. So I think if we didn't give it, she's gonna get another seizure. Huh? I'm like so lost. FTG. Right. If you did not. Okay. Well, we did. So we're not reading that card. I'm gonna cheat and I'm gonna look at it. So ignore this because we did not get this card. But if we didn't prescribe that, it would have said, "What a night! It's challenging being a doctor. So many details to track. Miss one and it can mean disaster. You've just taken a shower when the hospital calls. Gabriela is back in the ER. After she got home, she went into status epilepticus. Her seizure lasted 17 minutes before the ambulance EMTs arrived and gave her an anticonvulsant. She's still unconscious. It's unclear whether she has sustained any permanent brain damage. As you hang up, you realize your mistake. With her condition, she could have additional seizures. If only you had given Gabriela levetiracetam when you still had the chance. Well, but that is not us, because we did give her levetiracetam. So. Okay. The epilogue. Gabriela seems pretty set on having you take care of her face blotches first. She's also uncomfortable about having her mother present. If you ask about her YouTube channel, she opens up and confides in you that she smokes pot, that's why, but didn't have sex during her stay in Brazil. While helpful, it's still unclear whether she's being entirely truthful with you. However, when Gabriela experiences a seizure at 2 a.m., her condition becomes much more serious. With Nurse Judy's timer ticking down the seconds, your best course of action is to wait and see if Gabriela's seizure will quickly resolve on its own. Lorazepam will stop a seizure, but if you administer it within 5 minutes of the start of the seizure, it may oversedate Gabriela and cause her to stop breathing. If she does, you would need to intubate her, put a tube down her throat, to make sure she keeps breathing. When Gabriela's seizure resolves within 3 minutes, there is no longer a reason to give her lorazepam. However, to prevent Gabriela from having another seizure until you can find a cause, you should give her levetiracetam. Yep. Once the seizure is over, you consider possible causes. A drug test rules out drugs. When blood tests come back normal, an abnormal EEG suggests you run a more comprehensive test. That's basically what we did, but we didn't do an EEG. A brain CT scan shows that her brain is normal, but CT scans are not as effective as MRIs in revealing soft tissue conditions. If you ran an MRI, you would discover that Gabriela has nodules in her temporal lobe, which could point to any number of serious conditions. A lumbar puncture eliminates the possibility of meningitis and leukemia. To learn more, you'll have to perform a craniotomy. Oh, we probably should have done the lumbar puncture first. We're just immediately like, no, intensive brain surgery. You would have to perform a craniotomy and get a tissue sample of Gabriela's brain. If you take a sample from the wrong area, her brain looks fine. However, if you take a sample where the MRI showed a nodule, you would discover eggs of the parasite Schistosoma mansoni in Gabriela's brain. You give her the first dose of praziquantel to start her treatment to eliminate the parasite. With the parasite identified and dealt with, it's easy to overlook Gabriela's other, less urgent symptoms. Continuing with the dermatologist gives you several options for the cause of the rash. If you saw her video, you can see that the tree in the background she touches is actually a Brazilian pepper tree similar to poison ivy. So you were right, it's actually the tree in the video. Alternatively, you can take a skin biopsy to discover this. You can relieve her discomfort from the ration with either dexamethasone, calming lotion, or acetaminophen, and of course you shouldn't forget to run a urine analysis test to reveal Gabriela has a UTI, and then treat that with nitrofurantoin. Eric says, if she doesn't have meningitis, then a puncture is a waste of time. Yeah, but you do that to rule it out, and money. But I bet normal doctors will do it first anyway. Yeah, because you would definitely put a needle in someone's spine before you do extensive brain surgery where you have to shave the patient's head and cut their head open. Like, that is a normal thing to do. Because if it is meningitis, they would have been like, why did you not do the other less invasive thing first? So I get it. I'm feeling pretty vindicated, though, with all the other stuff that's less urgent that we did do. And the reason why I did lotion so soon, by the way, is because she kept scratching it and complaining that she was itchy. So I'm like, maybe she'll be more helpful. All right, so scoring. This part I care about less, but it is fun to see what they would do. Eric says, we are one of those TV doctors that go straight to this because we have great intuition. Exactly. There's drama around a doctor who is lower in rank than us, but we still go through with it, and we are right. For sure. And then a couple of episodes later, we're going to do it again, and then we're going to be wrong, and then we're going to have this whole season arc where we have to learn humility, and we doubt ourselves. And they should hire us. Yeah. You can put this... Did you know, if you watch these streams, you can actually put this on your resume? Alright, so scores. 40 points if she survives the night. We did. By the way, I'm not writing down this entire thing. We talked about it, 40 points, because she did survive the night. Plus 5 points if you gave her a pregnancy test before operating to avoid complications, despite her telling you she hasn't had sex. Here's the thing. I had the same problem with the... with the tutorial patient. I'm burpy, I'm so sorry. Where they were also like, you need to do a pregnancy test. I know that a lot of women complain that they get unnecessary pregnancy tests done on them. And so I always keep that in mind, because I'm like, I would also be really upset if they just did that. It says, in real life they would probably do that, but this game time stuff is weird. Yeah, I mean, in real life it would also take time, but it also costs money, right? And like, I don't know. Eric says, in real life, the time that it takes is probably not the same. Yeah, I doubt that a pregnancy test would take 2 hours or something. I actually don't know. But still, you would have to pay for it. It's then on your bill. And if you're like, I absolutely cannot be pregnant, I feel like that's a risk that you sort of take. Although a minor can't really foresee those, consequences. But still. Okay, another 5 points. So we did not get those 5 points. Another 5 points. If you relieved Gabriela's discomfort from her rash with any of the things, you get 5 points. Yeah. Well, those are 5 points that I will take very gladly. Oh, minus 5 points if you gave lorazepam when she was no longer having a seizure. We didn't. Minus 10 points if you gave lorazepam during the first 5 minutes of the seizure. No. We stopped ourselves. We were considering it, and then we were like, no, wait. Plus 10 points if you gave levetiracetam to prevent her from having another seizure. Yes, we get those 10 points. Plus 20 points if you gave her praziquantel to treat her parasite. Absolutely we did. Minus 10 points if you did not prescribe an antibiotic for her urinary tract infection. She returned to the emergency room a week later with potential kidney failure. See, we should have done that. Eric says, a nurse stopped us from doing that and was like, doctor, maybe we should wait? And we reluctantly agreed. Exactly, it's all part of our arc. It's all part of the arc. Plus 5 points if you gave the correct antibiotic for her urinary tract infection. Urinary tract reaction. That happens when it's cold. Minus 5 points if you prescribed ciprofloxacin after Gabriela had her seizure, as it should not be used if a patient has ever had seizures. Well, we didn't, so. Plus 5 points if you recommend Gabriela take lorazepam twice a day to prevent further seizures until the parasite is eliminated. Oh, is this if I put that in the report? I mean, I would have, because it's in the thing. I'm giving us the points. We would have told her that, because it's in the thing. Plus 5 points if you remember. This is, by the way, this is the first time that I'm seeing in one of these scoring things that they actually want you to write down like the treatments and the times and stuff. Because the other points that they're going to give us is about how many doses she should take. And I'm like, that's just in the book. So I'm just going to give us those points. So that's 10 more points. And then it's giving us -5 points for each overtime action that we took. And we took 1, 2, 3, 4 overtime actions, so that's -20. But it also says, if you performed a craniotomy, see Saw. So I'm going to open Saw. Not the scary movie. A week later, you receive an email from Gabriela with a YouTube link. Take story card 38. Oh boy, I wish this was an actual YouTube link we could watch. That'd be so funny. Alright, let me see. 38. I thought we were done, so I just hit them all. Oh boy. The video shows a smiling Gabriela. She says, sometimes you have to take a collision with the ugly side of life to see how beautiful it is. She spins, no longer afraid to show the rash on her face or the fact that her head is shaved. I am alive and I am beautiful. Yes, you are, Gabriela. Good job. Good for you. We love self-esteem. Exactly. That definitely was not me at 17, I can tell you that much. Alright, so if we tally up our points, we would have an amount of points. I can't do maths on a timer. I feel pressured. Okay, that's 20, that is 40, that is 80, 90. So 95 minus 20 is 75. We scored 75 points, but I think we did well, team. So applause for yourself for helping this teenage girl. I feel like even though we took some overtime actions, I really do feel like we did this one better. I felt with the previous patient we somehow missed something. I was feeling very, very pressured to when the timer started, like that stressed me out. Anytime a timer in a game starts, I get stressing. But yeah, that was patient number 3. Mom says, I'm afraid for the next one. I know, me too. This was a medium one again, and the next one is hard, and I feel we're gonna have the same amount of time, so we're gonna have to really... Because I'm thinking, what could we have done to do this quicker? Because we took some overtime actions. Eric says, I was worried about this one because we didn't get that seizure card taken care of before overtime. Yeah, well, the seizure is always... I think the seizure was always meant to happen. Like, no matter what you did, she was going to seize. Unless you, like, magically gave her anti-seizure medication without knowing anything, but that, I don't know. I guess the lotion we could have done later, but I feel like we were like, maybe we asked a neurologist a little too early. We did we did a CT we didn't need, but it also told us to do another thing that we did need. It also talked about some questions we could have asked her that we didn't. So I feel like we were pretty productive with this one, actually, team. So I think we can be proud of ourselves. I think you're meant to go into overtime with this one. So I'm also fully expecting us to do that with the next one. But yeah, I will stream that. Eric says, this game also knows you won't just pick the right answer. Yeah, but I also don't think it's like extremely forgiving in that way. Because your patients can just die. I mean, I'm sure there's several cards in here that are just like, she died. Oh, man. The CT MRI was confusing because we didn't know which one would be better. I agree, and I think if we had done an EEG first, it probably would have pointed at something. The reason I was leaning MRI is because I did feel like that it's a soft tissue issue. Soft tissue issue. So that's NCTs, I think, are more used for like bone stuff, which we felt like wasn't. I have this disgusting card opening. I can't believe that was up when I got rated. That's hilarious. Oh my gosh. Anyway, tissue issue. Exactly. Let me look. I still need to post this, but I will be streaming next week. I will be streaming on Monday, same time as today. So I'll be starting at 10 a.m. PST, 1 p.m. EST, or 7 p.m. UTC +1, aka Amsterdam time. And I will be streaming the Monster Train 2 DLC that's going to come out on that day. It'll be fresh, hot off the press. The Destiny of the Real Forged DLC. So I'll be streaming that. And then on Friday again, same time as today, so 10 a.m. PST, 1 p.m. EST, or 7 p.m. UTC +1, I will be streaming this game again, Medical Mysteries New York. I'm going to do the last case, which is going to be the hard one. Apparently there is another difficulty, because it says 1 heart for easy, 2 hearts for medium, and then 3 out of 4 for hard. So, don't know what that's about. So we'll be doing a hard one, so we'll see how that goes. And I mentioned it before, I think. Maybe I didn't. But I also ordered the Miami one. I did mention it. It's hard to get. So I'll be getting that next week, so we will continue the fun of helping these people and supplying lotions when they need it. Eric says, my mom says, I like that they use actual pictures of stuff. Me too. I think it's drawn. I hope it's not AI. I really, really hope it's not AI. But I think it's drawn. But I like that too. You know, if you watch any medical stuff, you have to like, you have to be able to take that. I saw a post the other day. I don't know if y'all are watching The Pit, but it's like the newest hype in terms of like medical shows. It's really good. The new season just started. And we were going to have something, we were going to eat and then look at a show. And then we started watching it and we were like, nope, this is not it. This is not the show for that. You're better off watching Saw than watching The Pit. Eric says, either having the brain up or the cup of pee when rated. Yeah, I mean, it's a medical game, right? That's just what it's going to be. So yeah, anyway, thanks for hanging out. Hope to see you next week. And I hope you have a lovely day, evening, night, whatever, but definitely life. Bye.